Welcome to This Explainer. Today, we're going to completely challenge the assumption that over-the-counter painkillers are just harmless little pills. Together, we're going to dive into the surprisingly delicate science of how these medications actually work inside your body and look at what they might literally be costing your vital organs. I mean, seriously, have you ever popped a painkiller without even a second thought? It's a completely universal habit, right? You get a headache or maybe tweak a muscle, and you just reach right into the medicine cabinet for a quick fix. But today, we're zooming in on the invisible chemical chain reactions that this one simple action sets off. Because, listen to this, the National Institutes of Health offers a pretty stark warning. They state that taking painkillers every day for several years gradually leads to irreversible kidney failure. Now, while these drugs are usually perfectly safe in recommended short-term doses, using them long-term or incorrectly carries incredibly high stakes for your body's primary filters. So to understand exactly why this happens, here is our roadmap. 1. The hidden cost of relief. 2. The science of the painkiller. 3. The collateral damage. 4. The triple whammy effect. And finally, 5. Navigating safer choices. Let's jump right in. Section 1. The hidden cost of relief. The illusion of absolute safety. Okay, so we really need to tackle this widespread misconception that over-the-counter medicines just do their job and then kind of magically vanish without any biological consequences. The reality? Most drugs that can cause kidney damage are excreted exclusively through your kidneys. Because everyday medications like ibuprofen and naproxen sodium aren't broken down by your liver the way, say, alcohol is, your poor kidneys are forced to bear the absolute entire burden of filtering them out of your bloodstream. And there's a huge contrast between the two main types of kidney damage this filtration can cause. On one hand, you have acute kidney failure. This is sudden, it's often tied to dehydration or short-term painkiller use of under 10 days, and thankfully it's frequently reversible with emergency dialysis. But then you have analgesic nephropathy. This is chronic, totally irreversible kidney failure caused by daily use over years. It permanently destroys kidney function for about 4 in 100,000 people. Section 2. The science of the painkiller. How relief actually works. To really grasp why your kidneys get damaged, we have to geek out for just a second on the brilliant but super complex pharmacology of NSAIDs, non-steroidal anti-inflammatory drugs. It all centers around prostaglandins. When you get hurt, your body produces these chemical messengers from arachidonic acid to sound the alarm. They mediate inflammation, fevers, and the actual sensation of pain. But here's the catch. They also have absolutely crucial day-to-day housekeeping jobs, like keeping your kidney blood vessels wide open. Just think of the inflammatory response like a biological battleground. Your white blood cells are aggressively attacking pathogens, while those prostaglandins signal pain and swelling to protect the injured area. It's a completely essential defense mechanism. So the crucial piece of the puzzle is how painkillers actually interrupt this mechanism. They work by blocking two specific enzymes that create prostaglandins. On one side, you've got COX-1. Think of this as the housekeeping enzyme. It protects your stomach lining, controls blood flow to the kidneys, and helps your blood clot. On the other side is COX-2, which is triggered by inflammation and actually causes that pain and fever. Traditional NSAIDs block both. Blocking COX-2 stops your pain, great, but blocking COX-1 strips away the protective mucus in your stomach and seriously alters your blood flow. And here is where it all clicks together for your organs. NSAIDs cure your headache by blocking these COX enzymes, right? But doing that simultaneously halts the production of a vital prostaglandin called PGE2. PGE2's job is vasodilation, literally keeping the blood vessels leading into your kidneys wide open. So the crazy part is, when you take a pill to block the pain, you are simultaneously constricting those vessels. You're essentially starving the kidney's delicate filter, a tiny structure called the glomerulus, of the very blood flow it desperately needs to survive. Section 3. The collateral damage. What happens when the filter is compromised? Now that we know the mechanics, we really have to look at the dark side of NSAIDs and the severe collateral damage they cause across the rest of your body. Because blocking COX-2 dramatically alters platelet aggregation, which is how your blood cells clump together, taking these medications can heavily promote thrombosis. In plain English, it makes blood clots and heart attacks way more likely. And the data on this is just staggering. 3.26. I want you to remember that number. According to the research, if a patient has already had a prior myocardial infarction, a heart attack, taking the specific NSAID diclofenac increases their risk of a recurrent heart attack or death by an incredible 3.26 times. And this isn't after years of popping pills. This risk actually spikes in just the first week of treatment. Absolutely wild, right? But the collateral damage doesn't stop at your heart. By stripping away the stomach's protective COX-1 mucus lining, everyday painkillers increase your gastrointestinal risks by 2 to 4-fold. This can really quickly lead to dyspepsia, severe peptic ulcers, and even gastrointestinal perforations or bleeding. And unfortunately, this risk jumps significantly if you're over 65 or if you smoke or drink alcohol. Section 4. The triple whammy effect. A perfect storm for your kidneys. So the danger here escalates dramatically when everyday painkillers mix with certain common prescription medications. Nephrologists literally call this the triple whammy toxic cocktail. Here's what makes it up. Number 1, ACE inhibitors, or ARBs. Those are common blood pressure meds. Number 2, diuretics, or fluid pills. And number 3, NSAIDs. If you're already taking a blood pressure med and a diuretic, adding an over-the-counter painkiller into the mix impairs the kidney's blood regulation so severely that it can cause acute cardiac failure or kidney injury in just 30 days. We absolutely have to highlight who is most vulnerable to this. High-risk groups include basically anyone over the age of 65, patients with chronic kidney disease, folks with type 2 diabetes, or even just anyone experiencing dehydration. If you fall into any of those buckets, your kidneys are already operating under stress. That means even a short, mild course of painkillers could easily trigger a severe medical crisis. Section 5. Navigating safer choices, balancing risk and reward in the medicine cabinet. Okay, we've explored the heavy physiological toll, so let's bring this all to a practical conclusion. What do we actually do? Managing pain is a delicate balancing act, but the golden rule you absolutely must remember is this. Always use the lowest effective dose for the absolute shortest possible time. Here's a quick cheat sheet for you. When you're choosing an analgesic, paracetamol is generally your safer first line of defense. It carries almost no cardiovascular or gastrointestinal risks. But you have to avoid overdose because of liver toxicity. Naproxen is a solid option for inflammatory pain, with a neutral cardiovascular risk if you keep it under 1,000 milligrams a day, though GI issues are still a thing. Ibuprofen is generally preferred for acute pain as long as it's kept under 1,200 milligrams daily. And lastly, diclofenac. Because of its exceptionally high cardiovascular risk, its use should be strictly monitored and firmly capped at a maximum of 150 milligrams a day. Now, a quick word on special precautions. Expecting mothers really should avoid NSAIDs entirely. Using them in the first trimester literally doubles the risk of spontaneous miscarriage, and it can cause structural birth defects later on. For children, ibuprofen is usually preferred, but parents, you've got to be incredibly cautious. Do not give it to dehydrated kids, because obesity and being under the age of 5 significantly increases their vulnerability to acute kidney injury. And when you're dealing with fevers in kids, remember, treat their discomfort, not just the number on the thermometer. Which brings us to our final thought. The next time you reach into that medicine cabinet, I want you to ask yourself a simple question. Are you curing the pain, or are you harming the filter? By understanding the incredible science happening inside your own body, you can make way smarter choices, minimize the hidden costs of relief, and protect the vital organs that literally keep you alive. Thank you so much for joining me for this explainer, and I'll catch you next time.